All right, so we're gonna do a quick refresher today on some updates and how to do blow-by and how to connect our ambu bag for any time that you might have a baby that's in distress and you're a little bit panicked and need to know what to do. So don't forget that we do have a rapid response policy in Policy Tech. I'm not gonna go through all the details of that, but essentially when you're making the decision as to whether or not you want to rapid response a baby versus call the pediatrician, ask yourself how much time you have. Is this a time sensitive thing? I need an answer, I need an intervention right now. If the answer is immediate right now, probably your best bet is to rapid response the baby. If it is something that you have a question about, you need it addressed soon, but it can wait a few minutes for the pediatrician to call back, then your default should be to call the pediatrician. So if we need to rapid response a baby, reasons that you would want to do that would be you have maybe like a really low blood sugar, and the baby's not responsive and not wanting to eat, or maybe the baby looks discolored, maybe around their mouth, or their stats are really low, so you were concerned, you brought in your vital signs cart, and maybe the baby's stats are below 90 and you feel like you need to do some interventions. Obviously seizure-like activity, anything that makes you very concerned for the baby's well-being immediately needs to be a rapid response. So the way that you initiate that will be to call your rapid response number, and you need to use the words, I am rapid responsing this baby. Don't use the words baby check. That's not something that we typically do from the NICU anymore, so just make sure you use the appropriate verbiage so they know what the ask is. If you need to intervene in the meantime, what you should always make sure whenever you are taking care of a couplet, so if you're in this room and you're taking care of a couplet, you should be doing safety checks at the beginning of your shift. It is very imperative that every baby that is in a room has a flow meter. So if you don't have a flow meter in one of the rooms that you're caring for a newborn in, you need to call the respiratory department and tell them that you need a flow meter. It should be on the wall, ready to go, and you should also have blow-by tubing ready to go. So this can be in the room, you don't have to open it, it doesn't have to be, unpackaged, it just needs to be available. So if I am assessing an infant and I see that my stats are below 90, I have discoloration, but the baby is breathing on its own, you could initiate some blow-by. So the way that you're gonna do that is you're gonna pull out your blow-by tubing, you're gonna connect to your flow meter, and you're gonna turn it all the way up to 10. So you should have some really good flow coming out of your flow meter. And then you're gonna come over, tie the knot. I'm gonna come over to the baby, and you are going to cup your hands around the baby's face. So remember, the baby has to be breathing for this to be able to work, but I'm gonna cup my hands around the baby's face and create an environment where when they breathe in, they are breathing in all this oxygen that's flowing out of this, okay? And typically you'll see a pretty immediate response to blow-by as long as they have good respiratory effort. If you're not seeing a good response to this and you're not seeing recovery of your pulse ox, then you would want to progress your intervention. So at this point, if I'm not seeing recovery, that would be a good time to rapid response the baby. In the meantime, you can grab your bag and mask and get that ready if you feel it's progressing to the need to give some PPV. Now, of course, if the baby's heart rate is low and if the baby is unresponsive and they have major color change and you are very concerned, or we're having seizure-like activity, something like that, that's like, yeah, blow-by is not gonna work, I think maybe I need a bag and mask and I need somebody right now, you do have your infant code pink button. So this is not to be used if the baby has respiratory effort. This would be like the baby's apneic and doing nothing. Then you could push your code pink button and you're gonna get a much larger volume of people in the room. I want to go over how to set up the baby PPV bag and mask. Because when you pull it out of the bag, it's not going to be exactly ready to go. It's going to be kind of in some parts and pieces here. So when you pull this out, it's going to look something like this. Okay, this is a filter, so you can pop this on right here. And then you will need your PEEP valve. Hold on, I think I got this. There we go, on there backwards. So your PEEP valve, you're always going to dial this to 5. So if you can kind of see, there's some numbers right here, and this twists, okay? It's got increments of 5 to 20, so you're going to twist it down to 5, okay? And then you're going to pop on your infant mask, okay? At this point, because this is a self-inflating bag and mask, you can actually give PPV. You always want to ensure that your pop-off valve is not engaged, so this should be flapping right here. That's an important safety feature. At this point, we can give PPV, but if we would like to add oxygen, you're going to need to hook up to your flow meter. Okay, so you're going to hook up in the same place that I had my blow-by tubing, and now I'm actually going to be able to deliver oxygen to my baby as well as pressure.
When I'm giving PPV, do I always have to have an oxygen source?
You do not, no. So if you don't have an oxygen source or you're not close enough, this will work without an oxygen source because it is self-inflating. So just like whenever, hopefully that doesn't happen in real life, make sure this sucker's nice and tight on here. So you do want to do your head tilt chin lift. You've got to open the baby's airway, and we're going to put this on baby's face. If you are struggling to get a good seal and you can't kind of figure out how to do this in your bassinet, it would be very appropriate to move the baby to a hard surface. Here, that could just be this table in the room to give you better access, okay? And then you're gonna give your breaths, okay? And you're not gonna see this baby's chest rise because this baby doesn't actually have an airway that I can give breaths to. But as you are giving breaths, you're gonna be watching for chest rise. If you do not have good chest rise, you need to reposition your bag and mask, potentially suction the mouth out with a bulb syringe, go through your steps of Mr. SOPA that we teach you in NRP. Okay, at this point, you've got help on the way. We're just doing this until our NICU friends come to help us. If for some reason you had a bag and mask available to you, but you did not have blow-by tubing and the baby was crying and you're like, I don't actually need PPV, you could use this same tubing for blow-by. So this disconnects right here. So you can pop this off, and now I have basically the equivalent to blow-by tubing, and I can just hold this over the baby's face. We don't ever want to bag against a baby that is actively trying to participate in breathing and has good respiratory effort, but sometimes they just need the oxygen, and you cannot put this on the baby's face and hold it there without giving breaths. This is a self-inflating bag and mask, meaning it only delivers air when you are giving pressure through it. So if I hold it on the baby's face, there is no movement of air. So this is not appropriate. So unless we're giving PPV, we don't want to do that, but you could give blow-by. Okay. This is located outside the room. It has to be, it's right by the code cart. You have to go and get it. We don't usually have one in every single patient room, but it's just right outside the door. Okay. All right, that's all I've got.